Hello, everyone. Welcome to another session on eye health related issues. Today, we are talking on age-related macular degeneration with Dr. Niroj Sahoo, consultant ophthalmologist at LV Prasad Eye Institute. This is part of our series on eye health, which we are doing in collaboration with IHOPE. And I am Aparna Mittal. I'm the founder of PatientsEngage, an online platform that seeks to inform, engage, empower patients and caregivers in management of chronic conditions. We do believe that patients and caregivers who are better informed do take better decisions and are able to manage their condition better. So watch this session to be an informed and empowered patient. A little word about IHOPE. IHOPE is the Indian Health Outcomes Public Health and Economics Research Center, an exciting collaborative and interdisciplinary research center that has been set up with a research grant from Wellcome Trust DBT Alliance through collaborations between LV Prasad Eye Institute, Indian Institute of Management, Ahmedabad, and Indian Institute of Public Health, Hyderabad. The focus of this center is big data analysis, health economics, clinical and public health research in eye health. You can check out their website for more information. Our guest speaker today is Dr. Niroj Kumar Sahoo, consultant ophthalmologist, working currently as faculty at LV Prasad Eye Institute, Vijayawada. He's a postgrad in ophthalmology from JIPMER, Jawaharlal Institute of Postgrad Medical Education and Research, Pondicherry, and clinical fellowship in retina and vitreous from LV Prasad Eye Institute, Hyderabad. His areas of interest are macular and choroidal disorders, and he's a fellow of the International Council of Ophthalmology and has more than 50 papers in peer-reviewed journals. A quick reminder to our viewers, the information that is being discussed here does not replace a medical consultation, so please do consult your doctor for specific medical issues. If you have a question, you can ask us in our forums on PatientsEngage.com. Check out the website, www.patientsengage.com. Follow us on our social media pages. We are on YouTube, Twitter, Facebook, as well as Instagram. And if you have an experience to share, write into us at editor@patientsengage.com. So without taking more of your time, let's get started with Dr. Sahoo. So Dr. Sahoo, thank you for joining us today to talk about age-related macular degeneration. Can you start by letting us know what is age-related macular degeneration?
So we'll start by breaking down the individual words in the disease itself, age-related macular degeneration. So as the name indicates, it is due to advanced age, and it involves the macular region. So there's a slow decline in the function of the central part of the retina that we call as macula. And this results in significant visual and visual function impairment. Because we see a lot of patients now, people in the population now living more, around 70, 80 years now. The amount of patients who are affected with age-related macular degenerations are also in the rise. Right. So basically, we are seeing a lot more patients with AMD, and it has become a significant public health issue also in terms of the cost of treatment that these individuals have to undergo.
Right. And typically at what age does AMD, because you said it's age related, so typically at what age does it increase?
So there is no fixed age limit, but up around 50 years later on, it tends to start more often. But around after 70 years, the risk actually becomes significantly more. So I'll say for more than 50 years, individuals, the screening becomes really important. And again, it becomes a public health burden because we see a lot of patients now living up to around 70, 80 years old.
Right. So we'll come back later to, if there are other causes, but can you tell us what are the symptoms of age-related macular degeneration that, a layperson should be watching out for? And are there different types of AMD? And to the audience, if we are using the term AMD, it means age-related macular degeneration.
So I'll just like to share my slides. So I'll just like to show what exactly the macula is and how it involves our vision. So if you look at this picture, this is the retina of a normal, healthy individual. And the central part is called the macula. So it's around the size of maybe a rice grain. It's around 5 mm in size. This is very small part of the retina, but it contributes to the maximum visual acuity that we say. So most of the vision that we have, we use for reading, writing, and recognizing faces, color, and contrast. This all happens due to intactness of this part of the retina. So whenever this gets involved, majority of function is lost. So these patients typically start with decreased vision of the central part of the visual field. And it really hampers their well-being, and a lot of patients go into depression and loneliness.
So when you say it hampers, and again asking as a layperson, if you're saying it hampers the central part of the vision, which means what? They still have peripheral vision, but they can't see
yes.
in front.
Yes, that is a little bit of good news for them, because it starts in the central and it stays center. So these patients usually do not go completely blind. It is mostly a central vision defect. So they will have difficulty in their day-to-day activities, but it can be enhanced, and the side vision can be utilized to improve their day-to-day activities during rehabilitation. So this is one of the good signs that you do not go completely blind with AMD. Only the central vision gets hampered.
Right. Okay, thank you. And are there different types of AMD?
Yes. So I'll just like to show a few more slides. The first type is we call it a dry AMD. We call it dry because there is no fluid in this. So it appears slowly, it gradually progresses. And you can see these small areas of islands of atrophy that we call. These are areas of degeneration that sets in slowly and increases, keeps on increasing, and leads to central vision defect. But there is another form, that is a wet AMD, where there is some amount of fluid that escapes from small, tiny blood vessels. And this fluid can slowly damage the retina. This damage again keeps on progressing, and it again leads to vision loss. This fluid, it may or may not be accompanied by some amount of blood, and often results in scarring. So this is, if not treated, it again leads to central vision loss very fast. But the good news is this is treatable, the wet AMD, but the dry AMD, unfortunately, there is very less treatment available.
Right. Okay. And do the symptoms of, age-related macular degeneration, do they overlap with any other conditions? Because we've talked, for instance, in the past on glaucoma or retinopathy. Are there overlaps, or is it, if you have AMD, or if you have those other conditions, you don't have AMD, or vice versa?
So this is a disease of macula. So any disease that involves the macula can have overlapping features with AMD. But glaucoma, if you ask me, glaucoma starts from the periphery, and keeps on increasing until it reaches the central macula. So it starts from the periphery, involves the macula, and eventually patient can go completely blind. But here it starts from the center and it stays in the center. So it is completely different from glaucoma. But yes, because these patients are around the same age group as patients who develop glaucoma, these two entities can coexist. And we often check for both these entities when we go for, when patients come to us for screening.
Right. And the treatment for both will tend to be different, right?
Yes.
Okay.
So
we'll come to the treatment later. So apart from age, what are the other causes of age-related macular degeneration? Is there anything which is a controllable risk factor?
So if you break it down to risk factors that are modifiable and non-modifiable, risk factors such as age and our genes, we cannot do anything about it. So there are some individuals who are predisposed to developing AMD. So, but the things that is in our control are smoking. There is one of the biggest risk factors. People talk a lot about smoking being injurious to your lungs, but rarely they talk about it being injurious to your eyes also. So smoking is a big risk factor. It should be controlled in every way possible. Other risk factors, like any other body illness, it can be your diet, obesity, hypertension, your cholesterol levels. These are all, they contribute to the risk factor and can really matter in some individuals.
Right. Okay. Thank you. And we've talked of the different types of AMD. How does one test for AMD, or when should one test for AMD?
So usually, routinely, we can ask the patients to have an eye examination. Beyond the age of 50, we usually ask them to have regular eye checkup. It is really not easy to detect AMD, but if you're having complaints of central vision loss, then you should visit your doctor. And usually the detection of AMD is clinical. We usually we have to check and then detect and diagnose it as a case of whether it is AMD or not. But central vision loss is the most important symptom that patients present with. So if you're experiencing central vision acuity loss or decrease in central visual acuity, then you should get it checked at least once, and subsequent follow-ups can be tailored according to the diagnosis.
And for someone who has not yet experienced, because you said it starts from the age of 50, is there any screening protocols for, typically all eye issues, but also specifically for age-related macular degeneration?
For screening protocol as such, there is no such screening protocol, but once diagnosed, follow-up is again tailored based on the type of AMD, and depending on whether it is wet or dry, the follow-up is usually either a monthly follow-up or depending on the severity, we usually increase or decrease the duration of follow-up.
And when you said that, you kind of do some testing, what are the kind of tests that are typically done for AMD?
So for AMD, again, best will be a clinical test where the ophthalmologist directly looks at the fundus and looks for signs of any AMD. But other tests like optical coherence tomography or a fundus fluorescent angiography, usually we do to detect, again, the type of AMD so that it helps us to guide the treatment process. And again, it is useful for follow-up also, to see whether the disease has responded well to the treatment or not. So these are some of the tests that we usually perform routinely for AMD patients in the clinics.
Right. And, in terms of testing, because typically by around the age of 50, you're also having reading glasses. So you're going and seeing an optometrist. Is there any indication that you will get through an optometrist visit on whether you have an issue or not, or at least an indication? I'm not saying that you will get a formal test, but will you have something that, or it's basically your own assessment of the symptom that you're having, central vision loss?
When these patients go to the optician and they get it checked, the vision acuity usually does not recover to the exact 6x6 that we say. They don't usually read 6x6 letters. It is usually slightly subnormal. It never improves to the extent that what normal individuals see. And many individuals, they experience something called as metamorphopsia that we say, where the lines appear blurred or zigzag. So this is one of the earliest indication that there is something wrong with the macular area.
Okay, thank you. So what are you said that there are treatment options for both dry and wet AMD. What are the treatment options that are available now?
So dry AMD, unfortunately, there are no treatment options, but wet AMD there is. Wet AMD, what we do is the current standard of care is giving intravitreal injections of anti-VEGF that we call as anti-vascular endothelial growth factor. So we usually inject, and we usually ask the patients to follow up at regular intervals, and we aim for a completely dry macula. So that means the endpoint should be there should be no fluid that causes vision loss in the future.
Right. Okay. And the frequency of this is personalized, is it? The frequency of
yes.
injection?
That depends on the patient and the type of the severity of the disease. Some patients usually require less injections, but on an average, around 7 to 9 injections in the first year itself, the patients usually have to take. And
sorry,
again,
did you say 75?
7 to 9 injections.
7 to 9, okay.
7 to 9 injections per the first year. It usually tends to decrease over the years, but initially in the first year itself, it is usually around 7 to 9 injections, and it keeps on decreasing. But the aim usually is to stabilize the vision. It will not improve to the extent how much the patient wants. It will never be success, but it will at least maintain the vision, and that should be our aim in these cases.
Right, right. Okay. And can, I mean, I know you said smoking is a risk factor, so, you should reduce smoking, but is there any way to prevent age-related macular degeneration?
Unfortunately, there is nothing that we can do. As I said, age and genetic factors, these are two most important non-modifiable risk factors. Correct. But yes, certain habits can be changed, lifestyle modifications, including antioxidants in your diet. These can, to some extent, reduce the progression of the disease from the intermediate to the advanced forms. So yes, these can be used to some extent to reduce the progression rate.
Right. Okay. So let's understand now. We've talked of what is age-related macular degeneration. We've talked of symptoms. We've talked of the types and treatment. We've talked of risk factors as well. But having now been diagnosed with age-related macular degeneration, how does one manage the condition, and what is the follow-up protocol expected?
So you have brought out a very important point, because even after trying extensively with the treatment, a lot of patients usually do not go back with a very good vision. So here comes the importance of visual rehabilitation. So rehabilitation services in terms of visual aids, and basically, more importantly, they need support from friends and families who can be with them, because these patients become very depressed because of the loss of central vision. So visual aid and help from family members is one of the most important aspects that I would like to recommend for all these patients. In terms of follow-up protocol, as I said, it is based on injections and the response to treatment. So depending upon whether the fluid is coming back or not, we usually keep on injecting and try to keep the macula as much dry as possible, and for longer duration of time. So this tends to maintain the vision for whatever lifespan they have remaining.
Right. Thank you. So just for our audience, we have touched upon vision rehab in an article as well. So, if you're watching, you can check that out. We'll add it in the notes. And also we are planning to do a session on vision rehab as well, because I think it's an important factor which often gets missed out in our context. Quite often people don't know that there is something called vision rehab as well. So are there exercises that people can do to, manage or delay the progression of AMD?
Unfortunately, no, there is no such exercises in the eye that delays the progression. But yes, so basically AMD just have awareness with respect to AMD is extremely important. The need for frequent follow-ups, and you have to understand that injections, although it might not completely recover the vision, it is extremely important for them to at least regain the whatever vision they have in the long run. So support from family members and rehabilitation is extremely important.
Right. And is there ever a surgical intervention required?
There are few devices that are coming up that can become popular in the future. The devices that have intraocular implants, like the Argus implants, but they're yet to come in the mainstream. They're
Right.
extremely costly, and there is still a lot of research is going on. So we're hopeful in the future it will come back really well.
All right. Thank you. Thank you, Dr. Sahoo, for taking the time to talk about age-related macular degeneration. And, thank you for our audience. And we will take a look at the links for both vision rehab and for more information on eye-related issues in the notes as well. So thank you once again, Dr. Sahoo, and to IHOPE for supporting this session.
Thank you. Thank you, Aparna.